Welcome. Have you ever felt overwhelmingly sleepy during the day, like you're fighting an invisible force pulling you under? Or perhaps experienced sudden muscle weakness triggered by strong emotions? If so, you might be wondering about narcolepsy. In this video, we'll delve into this fascinating and often misunderstood neurological disorder, exploring its causes, symptoms, and available treatments. The exact cause of narcolepsy remains elusive, but scientists believe it's a complex interplay of genetic predisposition and environmental triggers. A key factor is the deficiency of hypocretin, also known as orexin, a neurotransmitter in the brain that regulates wakefulness and alertness. While the precise trigger for this deficiency is unknown, in many cases, it's thought to be an autoimmune reaction where the body's immune system mistakenly attacks and destroys hypocretin, producing cells in the hypothalamus, a region of the brain involved in sleep-wake regulation. Some researchers also suspect that genetic factors increase susceptibility to narcolepsy when combined with environmental factors, such as infections. Let's explore the pathophysiology of narcolepsy. The cornerstone of the illness involves the disturbance of normal sleep architecture. Normally, we cycle through different sleep stages, progressing from wakefulness to light sleep, deep sleep, and finally REM sleep. In individuals with narcolepsy, this cycle is disrupted. The most profound disturbance is the entry into REM sleep almost immediately from wakefulness. Individuals also experience frequent, brief intrusions of REM sleep during wakefulness. Hypocretin is critical for stabilizing wakefulness and inhibiting the premature or inappropriate onset of REM sleep. The loss of hypocretin disrupts these stabilizing mechanisms, causing unstable sleep-wake boundaries, resulting in excessive daytime sleepiness and cataplexy. Narcolepsy affects an estimated 1 in 2,000 people, making it a relatively rare neurological disorder. However, it is also often underdiagnosed and misdiagnosed. It affects both men and women equally, and while it can occur at any age, onset is most common between the ages of 10 and 30. This makes early recognition of signs and symptoms crucial for timely diagnosis and management. Narcolepsy impacts individuals globally, with prevalence rates varying slightly across different populations. The hallmark symptom of narcolepsy is excessive daytime sleepiness, or EDS. This isn't your average tiredness, it's an overwhelming urge to sleep, even after a full night's rest. People with narcolepsy may experience sleep attacks, falling asleep suddenly and unintentionally. Another classic symptom is cataplexy, a sudden loss of muscle tone triggered by strong emotions like laughter, excitement, or anger. This can range from a slight weakness in the knees to complete paralysis. Other symptoms include sleep paralysis, a temporary inability to move or speak while falling asleep or waking up, and hypnagogic or hypnopompic hallucinations, vivid, dreamlike experiences that occur while falling asleep or waking up, respectively. Disturbed nighttime sleep is also common, which can include frequent awakenings and insomnia. Diagnosing narcolepsy typically involves a thorough medical history, a physical examination, and specialized sleep studies. The first step is often a sleep diary, where the patient records their sleep patterns and daytime activities. The two main sleep studies used are polysomnography, or PSG, and the multiple sleep latency test, or MSLT. PSG is an overnight sleep study that monitors brain waves, eye movements, muscle activity, and heart rate to rule out other sleep disorders. The MSLT is conducted the day after the PSG. During the MSLT, the patient is given multiple opportunities to nap, and researchers measure how quickly they fall asleep and whether they enter REM sleep. Falling asleep rapidly and experiencing REM sleep in at least 2 naps is indicative of narcolepsy. Narcolepsy is broadly classified into 2 main types: narcolepsy with cataplexy, also known as type 1, and narcolepsy without cataplexy, or type 2. Narcolepsy with cataplexy is associated with a deficiency of hypocretin. The diagnosis is generally confirmed with a low hypocretin 1 level in the cerebrospinal fluid. Narcolepsy without cataplexy presents with excessive daytime sleepiness, but lacks the hallmark symptom of cataplexy. These individuals typically show normal hypocretin levels, thus diagnosing this variant can be more challenging and may also be referred to as idiopathic hypersomnia. Some individuals may progress from type 2 to type 1 over time as cataplexy develops. While there's currently no cure for narcolepsy, there are effective treatments to manage the symptoms and improve quality of life. Medications are commonly used to address both excessive daytime sleepiness and cataplexy. Stimulants, such as modafinil or armodafinil, are often prescribed to promote wakefulness. Sodium oxybate is effective for both excessive daytime sleepiness and cataplexy. It works by consolidating nighttime sleep and reducing sleep fragmentation. Antidepressants, such as selective serotonin reuptake inhibitors SSRIs or serotonin norepinephrine reuptake inhibitors SNRIs, can help control cataplexy. Lifestyle modifications are also important. These include maintaining a regular sleep schedule, taking short, scheduled naps during the day, avoiding alcohol and caffeine before bedtime, and managing stress. Currently, there's no known way to definitively prevent narcolepsy. Due to the possibility of autoimmune involvement, strategies aimed at modulating the immune system are speculative, but currently being examined in clinical trials. Maintaining good sleep hygiene practices, such as establishing a regular sleep schedule and creating a relaxing bedtime routine, can help manage symptoms and improve overall sleep quality. Research into the autoimmune mechanisms involved in hypocritin cell destruction may eventually lead to preventative measures. The prognosis for individuals with narcolepsy varies. While the condition is chronic and lifelong, symptoms can be effectively managed with medication and lifestyle modifications. Many people with narcolepsy lead fulfilling lives, pursuing careers, relationships, and hobbies. However, it's important to acknowledge that narcolepsy can impact daily functioning and quality of life if left untreated. Recent research is focused on identifying biomarkers for earlier diagnosis, developing new medications that target the hypocretin system more directly, and exploring potential gene therapies to restore hypocretin production. The future holds promise for improved treatments and a better understanding of this complex sleep disorder.